I've got a fairly challenging task that the organisers gave me in what they wanted me to speak about, but what I'm trying to do is connect two areas, and that is the talking about evidence and effectiveness in health promoting schools, but I particularly want to focus on implementation. And in doing that, I want to acknowledge a colleague at the University of Bergen, Audrun Samdal. She and I have between us 35 years experience in health promoting schools, and we met on Bondi Beach, and many of you would have heard about Bondi Beach in Australia, and we were talking about the work we'd done and where the problems were and so on. We decided that we would write a paper together. That was nearly 5 years ago, and we've ended up writing 2 papers, and we're in the process, an advanced process of finishing a book, and it's about implementation. So when I start to talk about that area, I'll be acknowledging her contribution to that. One of the things you may have heard people talking about during the yesterday is the importance of context, and I thought that I would start with that, and that sort of is an overarching concept that I want to talk about, or will be the background to what I'm talking about. And I thought, well, the best thing to do, being an English teacher, I'd go to find out what context actually is, and instead of going to the dictionary as I used to do, I went on to Google and found this definition in what is now called Wiktionary. So that was a new word for me for the day. And the important thing about this, that it's about surroundings and circumstances and backgrounds and settings. And I thought, oh, well, there's settings there, you see. So we've got health promoting schools already connected with context. So I want to use this to look at what's the evidence and what's the context of evidence and effectiveness and health promoting schools, and what does this require? Why does this require an expanded paradigm? Now, yesterday you heard people talking about a paradigm shift, and I don't want to use that phrase. I'll talk about a conceptual shift, but I want to talk about that we actually are looking at an expanded paradigm, because we already have a paradigm, and if you're saying you're going to have a shift, to me that says you're going to get rid of one and have another one. And I want to say that it's actually expanding what we've already got. What are the contextual understandings then that we have about health promoting schools? I want to look at efficacy and effectiveness, evidence-based practice and practice-based evidence, and the preventive science approach. The whole idea of efficacy studies and effectiveness, those of you who are researchers and evaluation, this will be a very familiar term to you. But when we're actually talking about efficacy, it's usually randomised controlled trial studies, and this is part of the area there where there's a great deal of controversy when you come into work in settings in health promotion. And it's taken under experimental and controlled conditions. Effectiveness is when you then try to take those studies that have created some sort of efficacy and you try to translate them into the real world. And this is what they talk about as the dissemination of efficacious studies. And you often hear people talking about the research to practice gap, and it's very common in the States to talk about all the money that's been expended on these trial programs, these pilot programs that have been found to be efficacious, but we haven't been able to get them into expanded to wider dissemination. The whole problem here is that what is trialled in the controlled trial conditions is often a standardised program, and the more standardised it is, the better for the researchers, because they can get much better and clearer outcomes from it. The conditions can't be changed, so commonly somebody will say, we have this great program, say, on anger management for boys, and we want you to trial this in your school. It's going to take 12 weeks, and you've got an hour a day to do it, and we'll tell you what you're going to do. Now, those of you who are in the audience are teachers know that any group of students you work, be they the same age and the same grade, you may have to do different things with them because they're different. or this school is different to that one. You know that the last school you was in, you would never be able to do this, but you could do it this use. And these are some of the important things that make the issue of standardised programs and their implementation in schools and health promoting schools as problematic. The other thing we need to think about is when we're thinking about evidence, and I'm not going to give you reams of evidence, you can go and read that for yourself. I'm going to talk to you about where all the problems are around interpreting this, because it isn't a clear area in terms of what people are claiming and what can. One of the things that people judge it by is the research design. So they'll say, well, you've got to have a controlled study, or you have to have at least an experimental design, or a before and after. You'll have all of these things that people are making the judgments about. And then they'll say, well, you've got to do a survey, or you must do a observation. More recently, there is other voices coming into this, and that's particularly some people who say you need the voice of the participants, or you need the voice of the group that you're working with. And this is particularly important when it comes to what you're trying to do. And this is where your whole idea of your research design is really bound up with what you're trying to do. So the questions you're trying to ask have to be bound up with, well, what are you trying to achieve? Now, if you're trying to understand young people's interaction now with technology, you don't go and you make assumptions about it and ask them the questions. You start with them and you ask them about how does technology influence your life? What are you doing about that? And then you build from that. And then when you try then to find out whether, some of the ideas that you have come up with work and you've devised some sort of program or something, then you might then evaluate it. But in your evaluation, you then have got to talk to them again and saying, is this what's working? Does this match what you're doing, as well as any other measures that you might want to use? Now, this is the whole idea about your research design. You've got to think very carefully about what are you trying to do, not what is the best by somebody else's standard. It's the form and the focus that your research takes. So let me give you some examples. So statistics are great. Politicians love statistics. Policymakers love statistics. With a 10% increase and, 20% and 1 in 5 and so on. So sometimes you have to be political. You have to include something that you're going to be able to, or use the data that you have to come up with some numbers, because they love numbers. That's just living in the real world of funding and politicians and getting money. So statistics, but they're actually about, the form is statistics, but they're about behaviour change. So that could be one focus for some people's research. Another focus might be reports about quality implementation, and you're not going to find many of those because I'll tell you why later. But some people like reading, what did other schools do? What did they actually do there? So they're looking for a report, and they want implementation. Now, the report might be a verbal report, or it might be something in writing, but the focus for it is implementation. There are many researchers now who've recognised the whole value of actually getting the voices of the people you're working with. In Australia, in the mental health field, in terms of youth participation, we have the saying that says, nothing about me without me. And that's exactly what you need to do in the mental health field, but in other fields as well. Why are you doing research with teachers if you're not actually asking them about their practice and how are they doing it, and using that information with whatever you're designing to do, or to check that things are fitting what they're doing. So there you've got statistics, you've got reports, and you've got voices as your forms, and you've got individual behaviour change, implementation and participants. So you can see that range of what we're trying to do in this field is immense. There's the whole issue about what's valued. So who values what? So researchers and evaluators love research designs that they know will get them published in particular journals. Now, I've been a researcher. I can say these things about researchers. I've heard my colleagues say that. We need this sort of research design because then it's easier to get published in this particular journal. You just need to be aware of these things and when things are happening, and I'll talk about this in a moment in regards to systematic reviews. About funding, about policy change, so you need particular sorts of evidence is valued for those purposes. Or you've got stakeholders, and they might be teachers. Now, teachers like a certain sort of evidence. Not all teachers, but some do, and often health promotion people do not provide the sort of evidence that would help them with their practice. And this is where we get into the evidence-based practice and practice-based evidence. So, when we've been talking yesterday, we've been coming up with the idea that when we're health promoting schools is a complex area. And I'll talk a bit more about that. So what sort of evaluation approach? And I'm not talking about a research approach because that's even more complex. But if you're talking about how do you evaluate, how do you get evidence about what you're doing? What we know is in the 1990s, Dan Olwitz's work from Norway about bullying was one of the first ones that really caught people's attention. And he was the one who was taking a comprehensive approach. He said, you don't just try to treat the victims, you don't just try to treat the bullies, you actually have whole other mechanisms, and it has to be the whole school that's involved in that. I was involved in a school that was working on an implementation of bullying, and they were taking a comprehensive approach because that was what was recommended. And they said, well, we'll need to have a policy about this, but then we need to tell the parents what a policy is. Oh, but then we'll need to tell the students when they're coming into the school that what is a policy. So they changed a whole lot of things. They changed a whole lot of the information, the orientation of students to the school, how they set up things in the school. So the whole school changed about it. And that was the whole point about what we're saying when we're talking about whole school or health promoting schools. So this was whole idea of taking a comprehensive approach was operationalised in health promoting schools, healthy schools. It's got a number of titles. They're roughly the same things, although it depends on the orientation the people implementing are doing. But it's really complex. You've got people, you've got places, you've got environments, you've got policies, you've got resources, all of these things. And this is why the evaluation is very complex. So the form it takes, unfortunately, health research and health promotion in most countries has been the driver of health promoting schools. It was the World Health Organization idea to begin with. They came up talking about settings, and this was their orientation. But health research, when they came to look at the research, and when they still come to look at the research, they'll say there's very little evidence that says health promoting schools works. Now, the number of times I've heard that, I could, fill up a book with the comments I've heard about that. And that's because they have a particular view about evidence, they have a particular view about the way it should be collected, they have a particular view about implementation. And this is why I'm saying all of these things are connected. There isn't a clear picture about this, although I'll give you some directions. The critiques about systematic reviews said the research design basis developed for reports, inclusion and reviews ignores quality implementation. And when Audrey and I first started our work on implementation, we did an analysis, we got something like 800 articles that were supposedly health promoting schools or whole school approach. But there were so few of those articles that actually told us what happened in the school. They said they had these great aims, they had these great things and so on, and then said these were all the indicators and we use these to measure. He said, but what happened in the school? And often that's just not reported. In health promotion, that's called the process. Process evaluation that's the weak evaluation. You don't have to talk about that. It's one of these things that's been put in the sideline. But those of you from schools know that what happens actually in the school could be quite different to what you report to some outside evaluator. Because you have to change this for this class, or we didn't have 50 minutes, so we made them all 30. And all of those things make a major difference to the outcome of any particular program. The focus of health sector interventions has been, and we heard this yesterday, the delivery of service model. I've even heard in Australia of health promotion people being put in a health service department because that's the way it was seen. And it's very much tied up with a time-limited project and program, and schools, this is the flavour of the month, we heard that yesterday. But the problem is, that's the mindset that's still in many schools. We'll do this project for a while. It does not support school personnel to recognise and feel valued, to view the health of students as their key concern. So you're talking about how do we get health promotion or health on the agenda in schools. You've got to change the whole way that you approach it. You've got to change the way you think about it. You've got to change the way you talk about it. You're not going and doing a project in the school for 12 months. You're trying to work with the school to bring about whole school change for a period of time, and maybe that should forever. If you're really thinking about it, you want the schools to be good and healthy schools. Full stop. Not for 12 months of the project. You want them to be like that. Now, that's a pipe dream, but there's no reason why we can't be building that and coming back and revisiting it in different ways. So the evaluation challenge is then a limitation then of this prevention research. So this research where you have a designated type of program that comes into the school for a particular time, that we call that prevention research because it's a clear program, it's got a beginning and an end, it's done often by an outside person in the school. You're not building the capacity of the school at all. You might be solving some of their primes for that 6 months while there's some money to do something, but it's not sustainable. And these are all the sorts of things that when we're talking from a health promotion language, we're talking about engagement of people, we're talking about embedding things in systems, we're talking about changing the organisation. We're not talking about these projects or one-offs. A very popular phrase is, oh, it's a one-off. And schools know that. They like having one-offs because it's over and done with. They can put it in their school report for that year and, we've done that, aren't we? Great, we're very popular. The researchers from the university come in and they run a program in our school. And I know I'm being very cynical here, but that's the real world that surrounds all of these ideas about evaluation. So this is the problem, that we have all these efficacious programs that are not achieving sustainability in the real life in schools. So what do? The problems in existing health sector evaluation paradigms. So I'm saying that there is a way through this, and that's why I'm talking about expanding paradigms. We do need health prevention research. We do need that, but there's other ways. And one of the things that health promotion needs to understand is that the practice is not a standardised intervention. That's not health promotion, or a linear trajectory from beginning to end. That's really, you have to go often round in circles, revisit something, build it up again, focus on this area, focus on a different area. The research and evaluation models need to reflect and capture the complexity of implementation, and I'll come to that in a moment. So we need to expand the way that we've been thinking about research and evaluation, and therefore in a true understanding of health promoting schools as a setting. And we need evaluation designs that look at the multiplicity of factors, and we've had a range of people telling me these are all the factors that impact when you're trying to bring about a change in schools about health, and the multi-strategic action to do it. It's just not one way. Let me just spell out again what I think about in terms of when we're talking about health promoting schools, and in the health promotion language, that schools as settings. And that's where the change of a conceptual shift is. Instead of looking at students in a school or teachers in a school, you're looking at the school as a setting. And so when you come into the school, you're not saying, we're going to do nutrition. A lot of health promoting schools has started with physical activity and nutrition. And that's fine if that's what the school says is our priority. Yep, we're really worried about the obesity. But you would then work with them about that topic, but along with all the other ideas that you need to get. You may have to stage there. You need to acknowledge the complex interaction of the factors that impact on health in a system or organisation. You need to focus on individual competencies and the policies, the environments, the partnerships, the participation, the sustainability, and the empowering conditions. So you can see this is really hard. It's not an easy thing to do. to create health promoting schools is really hard because you're trying to change schools. And they're one of the educational research literature will tell you it's one of the hardest environments to change. You know, you've got this model of this. In most countries, the education and health budget, sort of parallel each other. They're huge budgets, they're huge organisations, and this is what you're trying to change. So, I've been talking about these contextual understandings about the research and your evaluation and your designs and your measures and how that then impacts on health promoting schools. So my argument is that you need to expand the paradigm. I'm not saying we don't need prevention research. We do need it because that helps identify very clearly what some things will work and what they won't. But as well as that, you need some other different sorts of research and looking at the area in a different way. Because I want you to add the educational understandings, and this is my second message. Well, second numbers of message. You need to have this complexity, but you need to have health and educational understandings together. Everybody who's working with a school needs to understand that setting nearly as well as the one that they come from. The more you understand it, the better outcomes you'll get from your evaluations, the better implementation that you'll get. One of the key understandings from education is the essential contribution of culture and context. And that's there comes in the evidence base. And this is where we have the idea of practice-based evidence. And I said to you, in a classroom, a teacher will take note of the context of this class. She knows about this class, or my school, the principal will think about my school. And then they'll say, but in this school, this is the way that we need to interact with parents. You can't do it like this. It has to be like this. And so schools have known that. This is the way schools operate. This is they've got, sort of research that says this is the way you go. But that then has to be accommodated when you're working with them. The evidence needs to remain closely connected to the situation in which it arose and not abstracted from it. So if you're reporting on an area or a region, you have to embed that in that region and say, yeah, well, of course, people will say it. They'll say, oh, yes, but this region's different to that. Well, you then have to say, well, what difference does that make to how we're doing the work or the challenges that we've got to? How much of it can we think about as context? And if that's the case, what do we need to change for this particular region? The intertwining of evidence-based practice and practice-based evidence. So that's what I'm saying with these two areas. Evidence-based practice is when, and it comes from a medical model, where you're working with individuals and so on. It's been translated to a model that is working with communities. It just doesn't work. But clinicians in health have always used practice-based evidence. They will change. There will be medical people who will change practice after N equals 1. They'll say, I've had this client who's done so-and-so. I've trialled this and we'll do this. Talk to some colleagues, let's do some more of it. So they do it on N equals 1. But then they'll say, well, we need to have a randomised control. So you've got this whole idea about people do get wisdom from their practice. They try things. That bit doesn't work, but that bit did. They'll try it again a different way. Oh, I did this last year, I'll try this. That's practice-based wisdom. This is where the problem is. It's in the middle. We haven't got enough of what goes on and getting the evidence of what goes on in the middle, and the people who are trying to do it don't know what goes on in the middle either. So lots of people have gone, and we wanted to do health promoting schools. I said, yes, but what do you want us to do? They're very organised around being task-oriented. So the expanded paradigm is one that looks at the science of delivery, quality implementation and sustainability. Again, this is the whole school approach that we're talking about. So it's about collaboration. It's about involving the whole community. It's about membership. It's about systems. It's about people. It's very complex, and that's what we're trying to do. I said to you that Audryn and I had been working on identifying a science base for implementation. And within that, we say that we accept that within implementation, it's not free-floating, these are the implementation things, they're actually within a particular context. And we need to take the whole school approach, even though we're looking at components, and we've identified 8 of them. We look at organised development and learning and a multidisciplinary base. Well, in looking to the future, we said, well, what would we want to have happen in the next 5 to 10 years? We said we want to have a theoretical and empirical base for implementation components of health promoting schools that tell us the what. What do you have to do, but why are you doing it? What's the theory and empirical base for why you're doing it? We wanted implementation and organisational change theories as well as health and educational. So we've gone to other bodies of literature. We're not just looking at health and education, we're looking at organisational change and systems theory. And these components are all interdependent. The ones I'm going to show you, they're not standalones there. We came up with these 8 components, and I'm in my last 5 minutes, so I'll just be speaking a little bit faster. It's very important when you look at these, you think, yes, professional development. But there's something else added to that, and learning. Those of you in the education field, and we had excellent examples from yesterday from Philippe, he talked about action in a situation. So you don't just go into people and tell them this is what you've got to do. You've got to make sure that there's a structure around them so they then learn as on the job. So they then go back and try that, and then they talk to their colleagues about it. So this has enormous implications. If you're trying to bring about some change in schools, then the school has to say, well, okay, we'll have Tuesday afternoons from 3 to 5, we will have the time for teachers to get together and talk about the project that they're working on or what they've learned in the week, or we'll use some other mechanisms for it. The other thing is that you look in the first sentence that the preparing and planning, the preparing comes from the educational literature on readiness, the preparing and planning for school development, right? We're talking about wanting to develop schools to become good, healthy schools. We want to develop them. The policy and institutional anchoring, we're trying to get it straight in the group, leadership and management, relational and organisational components. Student participation, and Peter was talking about that a lot. In England and Australia, student participation or youth participation is fairly well developed, and of course sustainability. The professional development, why and what and why. I'm just going to go through this very quickly because I'm running out of time, and it's really quite complex. I'll give you the reference to the 2 of the papers that have been published on this at the end of the time so you can read it. But really what we say, what do we mean when we mean professional development? This is what the literature says, and this is the literature that we went to. This was a theoretical base for it. So you've got all of these things in professional development, and of course a lot of this literature is educational literature, as it should be. Because if you're trying to work in schools, although that may have to change in terms of particularly the first point about the professional development and learning for health and education. There's a how. Well, how are you going to do all of those whats? And what's the theoretical or empirical base for why you're doing it? So for both the what and the how, you have a theoretical and empirical base. And I know it sounds terribly complex, and you actually need to read about it to grasp what it is. What we're saying is this is a science of delivery. And I'll just skip through that. There was a couple of experiences I wanted to talk to you about, but I haven't got time. Sustainability. We believe that in the next 5 to 10 years, if we're going to move health promoting schools forward, and this is the new understandings, we actually have to use those implementation components and test them out. And that is a way of then saying, and then because if you look at those components, you will find that they actually will build health promoting schools. If somebody can truly say that they've anchored the documents in their practice or in the school plan, if they've done good professional development learning and it's ongoing, if they've done all of these things, then we argue that they should be health promoting schools. But the next issue comes with sustainability. And whilst that's the last of the list, you should be thinking about sustainability right at the beginning. So you don't do anything that's going to cost thousands and thousands of dollars every year because you can't sustain that. You've got to do things that don't cost you that don't require a whole lot of people coming to the school. So you've got to be thinking about that in your initial planning. Interestingly, where Audrey and I are sort of about 9 months away from publishing a book on implementation. We've got a number of people around the world who've been writing case studies for us. One of the things that's coming out is some of the countries that we would have said had some of the best practice that was going on, the current economic climate has just blown that away. The money's gone. The money's gone for the projects. And they're reporting because one of the things we've asked them is what happened in your country sustainable? And some of them are saying, oh no, it's not sustainable. The colleagues in England who are writing the report said, oh no, ours is not sustainable, but Leeds is still doing it. And I thought, well, how can Leeds still keep doing it if it's not sustainable in other parts? So I said, you go and talk to the people in Leeds and find out why they can keep going, because they're the things that we want to know about in terms of sustainability. How do we know if health promoting schools is sustained? And that's a really interesting question, because somebody asked me 10 years ago, 15 years ago, do you think health promoting schools will last? And I thought about it and I thought, ideally, no, because ideally it should become school practice, and they're not ever going to talk about health promoting schools anymore. It's a good and healthy school. Or, well, this is what we do in this school. It's got nothing to do. They've forgotten all about health promoting schools. So, I want to conclude, I want you to think about these implementation components as a way for researchers and practitioners to move forward, that they will give you greater understanding in terms of sustainability and help evaluate the complexity. I want you to reflect on your practice, and as in the words of Socrates, the life that's unexamined is not worth living. Thank you.